Well, there he is, Dr. Mehmet Oz, the world famous and the friend of Newsmax, in an entirely new role, but one that he is supremely qualified for. That's the day he was officially made the administrator for the Centers for Medicare and Medicaid Services. That is a huge job. Sworn in by RFK with President Trump picked him. Dr. Oz, welcome back. How are you? How's the new gig?
Greg, this is absolutely the best job you could ever imagine having. You have a bunch of brilliant people who have tremendous expertise in how to manage insurance across the country. You have a president who's dedicated to making sure that what we do matters. A Congress which is supportive of making the changes that have been, for many years, desired by everyone who understands healthcare. And finally, it's happening. And this one big, beautiful bill that I was on in the Capitol Hill today talking about with the Senate is so close to passing, and it's such a wise bill. It's got the framework to address the fraud, waste, and abuse that we're experiencing. And I'll tell you, it's the most ambitious health reform bill ever. And it's just in time because the system is unstable. And if we don't address Medicaid in particular, but the exchanges as well, we're going to hurt a lot of vulnerable people.
I remember when you were talking about it with President Trump, and I believe RFK was in the room. You guys were really from the heart. This is what you've been kind of thinking about and dreaming about for a long time. So, the biggest change or the biggest offering that you're most proud of?
The biggest offering is to make sure the most vulnerable among us are protected. And every great society takes care of people who are having difficult times. And our society is great, so we need to do just that. But to make those difficult decisions, you have to challenge the status quo, which means you've got to deal with some of the fundamental underpinnings of the healthcare system. And I'll give you one really good example. Medicaid is costing us 50% more than it did 5 years ago, in part because we let everybody who wants to join. You just have to tell people literally on your own attestation what you're making. If you said you didn't have much in terms of money, then you got to have Medicaid. If you were an able-bodied individual on Medicaid, it was even better for the states because we weren't aligning the needs of the states to the federal government. They could cheat the system, and they did that very effectively. So we are passing a work requirement. It's very simple. You need to communicate and participate with your community. You can get a part-time job, up to 20 hours, go qualify. You can volunteer. You can get an education. Just do something that shows that you have an agenda for your life. You can keep your Medicaid. But if you don't want to do those things, you're going to lose that insurance. Now, I believe, I've got confidence in the American people, Greg, you do too, that most Americans, when facing that choice, are going to go off and try to get a job or make a difference in society. The battle now that's taking place in Washington is that the Democrats are arguing that's not going to happen, that people aren't going to work and they're going to lose their coverage. I believe that based on what happened over the last 2 years when 15 million people came off Medicaid because they never should have been on there in the first place, only about 10% went uninsured. The rest got a job or did something, moved to the exchanges, but they kept their insurance. I want the same thing to happen today.
When you talk to senators, both parties cooperating, behind closed doors, everybody being reasonable, are they being obstinate? What's it like when you're sitting down over this stuff?
It's a heated debate. The Democratic arguments are quite clear. They're arguing that we don't want to touch Medicaid in any capacity, that we should just let it go. And the reality is the Republicans are going to put $200 billion more into Medicaid, at least according to the House bill. We'll see what the Senate bill scores at. But that's a lot of money. But is that the right thing to do? I think it is. Put $200 billion into the program, keep it strong, but not $1 trillion. Which is what the Democrats want to put into Medicaid. But how do you do this in a thoughtful way? Well, the work requirement's a good example. Another very good example is making sure that you actually, with technology, can figure out how much people are actually making, so the right people are on Medicaid or the exchanges or wherever they need to be. You don't want people cheating the system, and you don't want to encourage that either, which is what happened in the last couple of years of the Biden administration. We have rampant fraud that's taking place now. Probably about $14 billion was stolen from the people who are most vulnerable among us, from Medicare and Medicaid. And a big reason is because people are on Medicaid in multiple states, and they don't tell you. And the states don't care if you know, because they get paid either way. And so the federal government gets on the hook for these issues, and it's not right. If you don't protect these programs and keep them stable and strong, they will begin to implode under the weight of the debt that they've incurred, and that will hurt all the people who currently benefit from Medicaid and the exchanges.
Information, truth is freedom. Is Newsmax. It's real news for real people.